Okay. Welcome everyone to the fourth trimester project Community of Practice. And it's my pleasure to introduce members of the Carolina Global Breastfeeding Institute, Catherine Sullivan and Kathy Parry. And I'll turn it over to the two of you if you'd like to say hello, and then I'll stop sharing so that you can share your presentation.
Good afternoon. Thank you for having us. We're really excited to be here today and have the opportunity to speak with you all. The fourth trimester project has been near and dear to our hearts from the very beginning because a lot of what we do is very much integrated into that. So just to give you a little bit of a overview, the Carolina Global Breastfeeding Institute is housed in the Department of Maternal and Child Health in the Gillings School of Global Public Health. And we are really tasked with activities and programmatic activities, implementation, research in the areas of breastfeeding and lactation. However, a family decides that they want to feed their infant. And also we do a lot of work in the birth practices space. So we do a lot of programmatic work in hospitals that are trying to improve their maternity care practices. Our founding director, Dr. Miriam Labach, was very much involved with birth spacing research. We are not in that space as much now, but we do a lot of programmatic type work in childcare, in healthcare, in training. So we do have a training program to train the future of the lactation fields. We have the first accredited lactation consultant training program in the US and the first one to go through reaccreditation. So we are reaccredited through 2032, which we're very proud of. But that's just a little bit about CGBI. I'm the director and an assistant professor in the department and the course coordinator for that lactation consultant training program. But my roots are in public health. So my first job out of college was as a WIC director / breastfeeding coordinator / vendor coordinator, pretty much everything in the health department, because I was in a tiny health department in the eastern part of the state. And then I was a food and nutrition agent for NC State, and then moved on to become a faculty member at the Brody School of Medicine. So taught medical students and residents for about 7 years. And then was the state breastfeeding coordinator for then the Division of Public Health. They're now in a new area of public health, but that's where I worked closely with Sarah on different initiatives through the Child Fatality Task Force. And Dr. Labach approached me in 2012, 2013 and said, don't you want to come back to academia? Don't you miss teaching students? And I did. So I landed at UNC in 2013, and it's kind of shocking to say that I'm like getting ready to hit 10 years at UNC, and that the Institute's been in place for, we're in our 17th year, which is, I had to do the math a couple of times. It really, has it been 17 years? It's crazy. But I'm going to turn it over to my colleague, Kathy Parry.
Yes. Hey, good afternoon, everybody. And I guess you can hear from everything Catherine shared, you're in good hands today. You've got the person with like pretty much the most experience in North Carolina in terms of lactation consulting. So all of your questions will be answered today. And I have been a support person to CGBI for over 10 years. So I started with CGBI as a student doing my public health training in maternal and child health, and have just stayed on as a staff member. And I absolutely love the work, and it's been really great. So I'm so happy to be here, and thank you, Kristen, for inviting us to be a part of the community of practice and talk a little bit about Ready Set Baby and some other lactation education resources. I live in Durham and have a 4-year-old. That's what I wanted to share.
Yeah.
So I think
Yeah, thank you both. I'll stop sharing so that you can share now.
Okay, thanks. Let's see. Okay, we're good. You can see that? Great. Okay. Well, thanks again. So Kristen invited us to talk about Ready, Set, Baby, which has been something I've been involved with heavily like the whole time I've been working for CGBI. It's an evolution. So I look forward to just sharing with you kind of generally basic information about that. And then I also thought about some additional resources that I would love for you all to know about if you don't already, that can help for lactation education for professionals. So just rounding it out. And then we have a lot of Q&A that we've received ahead of time that we've prepped for that Catherine's going to cover. And then of course, anything that you all have today, we'd love to answer as well. So I'll jump right in. This is our Ready, Set, Baby resource. Many of you have probably heard of it, but if not, we just wanted to give you some of the basics and then also just some new updates about the resource. So it's a patient booklet primarily, and it's intended to serve as an educational tool for prenatal patients around breastfeeding and lactation. It also comes with a companion educator flip chart, and I'll talk a little bit more about that later. But this is basically something that's been ongoing since 2010 when CGBI's lactation training students created the first version. So they were doing a lot of clinical shadowing at UNC Women's Hospital, and UNC Women's had a need for kind of a breastfeeding pamphlet for their prenatal patients. And so the students used that as one of their projects, and they created the first version of what is now Ready, Set, Baby. And we received funding in 2012 from WK Kellogg. And some of that funding we earmarked for this resource, and the vision was really to make it kind of something more national. So not just for one specific hospital, but something that any hospital could use who was working on their baby-friendly designation. So at the time, UNC was working on their initial designation, and so they needed something to engage their prenatal population. And they've since been designated and redesignated. So congratulations to UNC on that. So I will just share, besides kind of the basic breastfeeding management, lactation information, the resource is also intended to prepare families for delivery in a baby-friendly facility. So the idea is they kind of come to the birthing facility excited about these evidence-based practices, and they're also expecting them. So it helps them just feel more empowered. They can advocate for themselves if they know what's really good and what they should be receiving, barring any medical indication otherwise. So we like to share that as well about this resource. Just for those of you who are curious about baby friendly, this is kind of where we work quite a bit with hospitals who are working on their designation or a similar state recognition program. But just a quick context and framework for you. This is a public health initiative that was launched in 1991 by WHO and UNICEF. It's been researched and updated, and at the core of it are these practices. So these 10 steps to successful breastfeeding that support and promote breastfeeding and facilitate that in the hospital setting. And when a hospital can achieve those 10 steps and all the rigorous standards that go around it, they can apply for this designation. And we know that when hospitals are implementing these 10 steps, families have higher breastfeeding rates, which we know leads to better outcomes, not only for the breastfeeding parent, but also for the babies who receive the human milk. Across the globe, there are 150 countries or more who have some designated facilities. And there's about 20,000 across the globe that have been designated. It sounds like a lot, and it is a lot, but also there's, if you look at just global births, really there's only about 10% of our births in the globe that are occurring in baby-friendly hospitals. So the WHO is really looking to kind of make this more of standard care for everybody as opposed to a special designation. So those are some of the conversations happening now. To relate it back to prenatal breastfeeding education, step 3 of the 10 steps is the one that kind of asks hospitals to liaise and coordinate and communicate with their prenatal services to make sure that families are receiving consistent messaging and education on what to expect when they get to the hospital. So that is sort of where Ready, Set, Baby was envisioned. It was to kind of provide a resource for hospitals for step 3 so that they didn't have to really create it on their own if they didn't want to. So it's a way that hospitals can provide consistent messaging when they have multiple prenatal service clinics going on, lots of different health professionals providing the information. It is non-commercial since it's grant funded. We don't profit from it, and we don't actually sell the booklets, which is the question we get a lot. Some people just want to buy it really quick, and unfortunately they've got to figure that out on their own. They have to print it on their own, but we help them with that. It is conversational, and we try to encourage folks to ask open-ended questions before educating on a certain topic. And we have also pilot tested it and then kind of revised it over the years based on the information that we've learned from our evaluations. This is just a look inside. So on the left here, you see the table of contents. And then on the right is a sample page from the Skin to Skin page, so page 7. So you can kind of get a sense for what it looks like and the colors. And those circles there, those are the sections that contain kind of the recommended education topics that Baby Friendly designates in their 10 steps. And so when we were creating our resource and doing some research around it, we really felt like we needed to include a little bit more just to give it a more of a holistic feel and to kind of cover some of those basic just myths that are out there about infant feeding, and also just some anticipatory guidance to help families when they get home from the hospital, because that is when we see the big drop in breastfeeding rates. So that is why we have extra content. It does make it a little big. It's 24 pages, but clinics are able to kind of tailor this however they want. And we have one-pagers that, just get at specific topics if that's more their style, as opposed to a full booklet. So lots of options. This is a look into the flip chart, the companion flip chart. So it's totally optional, but it just helps an educator kind of get on their feet when it comes to educating about this if they're not used to it. So they can actually read suggested text and read suggested open-ended questions. And once you kind of go through it once or twice, you figure out how to make that your own and how to tailor those the way that you're talking about it to a specific person, ideally. So each of the topics has its own page. And if you were using the flip chart in an education session, the parent would see the big picture, and then the educator would see the flip side of that. So there's 3 ways that people can access this. The first is a print curriculum, so PDF that you can print out. We also have an online website and then a live class. So I'll just talk real briefly about each of these. The print curriculum is available on our website. You just fill out a Creative Commons copyright, and then you can get the PDFs, and you can also get a PDF that's printable at a printing press, so you could send it to an online printer. These are the languages available for the patient booklet, and these languages, we didn't just choose them. They were basically requests from the hospitals that we work with for their specific patient populations in their prenatal clinics. So we're always fielding those kinds of requests, and as we're able to, we'll add more translations. And they are straight translations. They are not, cultural adaptations or transcreations, or by any means. They are straight translations. So take that for what that is. And then the flip chart is in English and Spanish. The website is fairly new, maybe a couple years old now. This was made possible through a collaboration with the Connecticut Department of Public Health. They felt really strongly they wanted to provide this additional digital resource for the people that they serve up in Connecticut. So we've been working with them for many years now and are continuing to work with them on ReadySetBabyOnline.com. And there's currently an Arabic and a Spanish toggle button on the site. And we're working on updates to create just a more of an inclusive experience for in terms of the languaging. So that's our current project for this website. So I just want to let you know that was there. And then finally, we are offering a weekly Zoom class. We started this in April of 2020, so right after the pandemic hit. It's long. 75 to 90 minutes, but you really get a lot of comprehensive education. It's interactive. So if you're a patient and you come, you are asked to engage through the chat or verbally come off mute and, just answer some questions about the topic as we're getting into it. So it's really a great opportunity. It's also available for observers. So if any professionals or lactation students would like to join, they are welcome to. The link there will just take you to a page that has some flyers you could print out. There's a QR code, so very easily accessible. And you can see here, there's a bullet sharing that we added a bunch of information about COVID. So initially it was COVID and breastfeeding, COVID and birthing. Then we've added vaccine information for pregnant families and breastfeeding families. So a lot of kind of new and cutting edge research is included there in a way that makes sense to families, but that is not a part of the print curriculum. So it's only available on these live classes. I think that might be my last slide. Yep, for Ready, Set, Baby. So what I wanted to do now is just jump into some additional education resources that we wanted to share with you all for professionals. So there's 6 of them, and I can go through all 6. And just to let you know, we're going to be talking about physician resident curriculum, on-demand education for physicians. So we have 3 different options there. That's all free. We wanted to share some great breastfeeding and lactation videos that you can also utilize with your patients or your providers or health educators. We wanted to share about specific clinical topics and how to get information about a specific thing if you're dealing with a patient that has a specific issue, medications and breastfeeding, and then infant and young child feeding in emergencies. There is a new toolkit that I wanted to share with all of you. So the first one is just to let you know, there is a residency curriculum that has been in the works for a couple of years now. It's an ongoing effort. So they're continuing to add different sorts of links and different education content for this. So if you're affiliated with a school or know someone who's a faculty who's training residents, this is a great resource that they could implement as a part of the resident training. And that way, more physicians are coming into service having some basic education on lactation. So the second one is these on-demand options for physicians. Of course, anyone can use these on-demand options. It's not just for physicians, but they were created by physicians for physicians so that they have options for on-demand, quick, easy to access, free training. So you have to create an account and log in and all of that. But once you do, you have access to all kinds of training on open pediatrics, 100% free. If you search for breastfeeding, once you've logged in, you'll see there are a lot of different options for this Bella breastfeeding training. So I've enrolled myself here in this example in the one that's free. And you can see the other ones are $30, and that's if you would want continuing education credits for it. So a really great option there. And then you can see once you click on one of those, you'll see like 47 different videos that make up 4 hours of content. So another on-demand clinical physician training is through CGBI. We have something called the breastfeedinguniversity.com. And it's, again, something you have to register and log in. But once you log in, you will be walked through 4 modules. So this is a little bit different than like a video that we previously saw. These are more like interactive modules. So it's kind of like its own software that pops up. And you can see the content of those modules on our website. It comes to 2 hours. So there's 4 30-minute modules, and it basically covers BFHI and the 10 steps and contraindications to breastfeeding, medications, and breastfeeding. I think those are the 4 that we cover, but you can look at a lot more detail on those links there. And then one final option in terms of clinical training for physicians is the School of Public Health at Albany, the University of Albany. They have a breastfeeding grand rounds, and it's an annual event that they make the webcast publicly available afterwards. So you can go to this link and see the past 5 years of grand rounds. And then they also have links to some pretty comprehensive additional training on these topics that are listed below, some of which might be really interesting to you all depending on your setting. So free stuff, everybody loves free stuff. This is one of the other resources about videos. So these global health media, really, really well done videos. And you can search by the topic, the audience, and the language. So you can actually search for health workers, or you could actually search for patient videos if you wanted to show something in a waiting room, or just share something with patients. So I'm going to move on just so we can keep going here, but just wanted to let you know about that one. The Academy of Breastfeeding Medicine is a group that puts out all kinds of things and has a conference, but what I wanted to share is their protocol. So they have clinical protocols on really unique topics that have been authored by a group of people who are members of the Academy. And you can see an example of some of the topics there, but that's definitely not all of them. They're not exhaustive. So really great resource to find out about there. They also have ABM in a new education center that you would need to kind of log into and get an email and password and all of that. But that is something you might be interested in as well. I think they're transitioning their protocols over there and offering other things as well. And one protocol that we looked into recently was the new mastitis spectrum protocol. And Dr. Katrina Mitchell, she's the first author of that. She's in California. She's a breast surgeon. We had her speak at our conference for some of our hospitals that we work with locally in North and South Carolina. And she gave us permission to make that link public. So if you all would like to hear her speak on this mastitis spectrum update protocol, I would highly recommend it. You can click on the link there in the PDF that we'll give you at the end. And it's just really great cutting edge information that I feel like all clinicians should be aware of, so you can share it with your teams and your colleagues. I know she spoke at another conference in North Carolina as well in the fall, so some of you may have actually heard her there. All right, and then just two more resources I wanted to share. If you didn't know about medications in mother's milk, it's a publication, it's a book, but then they have a companion website that's free to access, halesmed.com. And so this is coming out of the Infant Risk Center, and it's just updated continually, all kinds of different medications and how they interact with breastfeeding. So you can find out, alternatives in certain situations if you need them. Lastly, it's the CDC's new resource. It's about infant and young child feeding in emergencies. And as with toolkits, there's lots of different pieces and parts, but I like the way they've organized it on their website because it's by audience. So if you are a person who's working in public health, you have this, this stuff on the left that you can look at. And if you're working directly with families, there's a few here specifically called out for that. They've got handouts. So I encourage you to just review that. So, ahead of the next hurricane season, we can be more prepared to support our families. All right, so I think I'm going to turn it over and just thank you for listening, and happy to answer any questions, but I'll turn it over to Catherine. We did receive a lot of questions from Suzanne ahead of time, and then I'm sure you all have some today.
Yep, Kathy, can you move to the next slide?
Yeah.
So we also wanted to make sure you knew about some of the more local resources as well. And so the North Carolina Breastfeeding Coalition, if you are not a member, you do not have to be a lactation professional to be a member of the coalition. And they have different resources on the website. They are the group that awards facilities for the what's called the Golden Bow. So when the hospital has removed the formula discharge bags from their facility, they can receive an award. They have a clinic award. They have a workplace award. So the coalition is very supportive, and they kind of break up their work by the perinatal regions of our state, those 6 perinatal regions that we've traditionally worked from in public health. And so there's different resources in those regions that are listed on the website. So it's a really excellent place for you to go if you're trying to find out what's happening in the breastfeeding world in your county or the counties that you're serving. Next slide. So many of you may be familiar with the WIC Regional Lactation Training Centers. There were 6 in previous years, and they were part-time positions in each of the 6 perinatal regions. And as of last year, they have switched to what's called the WIC Latch Centers. So these are the 3 lactation area training centers. The lead agency is Eastern Area Health Education Center. So Hannah Edens is the main person that oversees the 3 regional centers. But I wanted you to see this because they train WIC peer counselors, WIC peer counselor managers, but they also are able to train any healthcare professionals that serve WIC participants in the state. And we know that more than 50% of North Carolina's pregnant persons are on WIC. So that pretty much means that they can train any provider across the state if it's requested. And we also know that there are like hot button issues in different regions of the state. And so they can tailor the trainings that they're providing to healthcare professionals based on what's happening in their region. And they're very aware of what the hot topic issues are. So I would really encourage you to use them. That's what they're there for. They are all full-time now and are able to provide those trainings. So that's an excellent resource through our public health system. Next. We also have some additional handouts. So one of the questions we received was about how to address substance use, particularly alcohol and cannabis. Of course, those are always individual situations where it's going to require a patient-centered approach to listening to what's going on in that person's life, what they are willing to do, while also talking about risk benefit. And so several years ago, we were funded by the Kate B. Reynolds Foundation to create some lifestyle handouts. So we had tested these and they're available to you all free of charge. So you can download those printable versions and provide those to patients as you wish. But we have them on breastfeeding in your lifestyle, which covers some of the substance issues. And then going back to work or school, and then thinking from the employer side, what does that look like? And what are some of the things that you can do to support families? And of course, hopefully you all have heard that the PUMP Act, the Federal PUMP Act was passed. So I know a lot of people worked really hard to get that through, and it took years and years and years. So it kind of overrides the previous act that was a part of the ACA when President Obama signed it into law. So it overrides that and actually offers wider protections. So that was always a challenge in our state because we had state personnel policies that protected state workers, and then we had federal policy that covered hourly workers. And then there was all these people that fell out in between. So all those salaried workers that were not state employees had no protections. And now the PUMP Act helps to cover them as well. So we're very excited to see that roll out, that federal law, and see how it's implemented at the state levels. Next slide. We also have some resources in different languages that you can all access and use. So we know that we have a increasing refugee population that has come into North Carolina. And so we want to make sure that you have culturally acceptable and useful resources. So there's a link for those. And then of course, Kathy already shared like all the languages we have Ready, Set, Baby in. And so we also wanted to just share, if you aren't involved with Breastfeed Durham, so we've had like Breastfeeding Chapel Hill, Orange County, now we have Breastfeed Durham, and they have a really excellent website. They have grant funding currently to assist them with equity initiatives. So they are doing equity calls, webinars with leaders that are working in that space. And then they also have materials and links on their website. So we wanted to make sure that you had access to that as well. And then I think one of those last questions that we received, Kristen, this is in your wheelhouse too, was about realistic safe sleep and breastfeeding strategies for exhausted moms. And so I am going to put a link to the BASIS website from the UK because it is excellent and has many resources. I think Sarah and Kristen and I has served on the Safe Sleep group for many, many years for our state. And I think the biggest thing I would say about that is that we need to recognize that the Academy of Pediatrics recommends exclusive breastfeeding for the prevention of SIDS. In all our messaging that happens, sometimes we forget that they also recommend room sharing for infants for the first year of life. That is in the AAP guidance. And so, you know, we're careful not to take a really hardline stance when we're talking to families and the realities of what those families are going through. People do not intend to fall asleep in the bed with their baby, right? They are not purposefully putting their infant in harm's way. And so how can we educate families about what would be the safest way if they were to fall asleep? So making sure that we don't have other things in the bed, making sure that there's not a substance abuse issue in the household, in the bedroom with the partner. So making sure that we're doing things as safe as we can and that we are putting that baby, when possible, into a safe space next to the bed, and room sharing, not taking them into another space. Because I think we're forgetting that in all that messaging. You know, we're trying to control what's happening and we're telling families, oh, you have to have another space for your baby. And we're not saying, but it should be still in your bedroom close to you so that you can pick up on cues and you can react if there's an issue with your infant. And so what we want to discourage is the sleeping on the couch, putting babies in their buckets and leaving them there where their airways are not as clear. So we want to make sure that we are providing guidance that is very relevant for those families and affirming and, you know, really listening to what they're telling you, and not just throwing the laundry list of things they shouldn't do back at them. And so it's very individualized. And the same with the substance abuse too. It's very individualized. We know people drink, it's legal, right? So what does that look like for a family? And what does the timing look like for when you're feeding? What amount are you drinking? There's so many factors. So we can have these kind of population level guidance, but in the end, it's really the individual patient that's sitting in front of you and the individual family and meeting their needs and listening to them and affirming what they're saying and providing the best guidance that you can provide. In terms of, I think we covered most of the other things because we heard that you all needed to know what about, what are the resources upon discharge? What are the resources for providers? What are some of the languages that are offered for different materials? So we'd like to open it up to have any conversation, or you can ask questions on the spot. We're good with that. So if that sounds good to you, Kristen, and I don't know if you want to speak to any of the sleep issues. or not. That's up to you. I don't want to put you on the spot, but definitely that website from the UK is an excellent resource.
Thank you, Catherine and Kathy. That was wonderful. And I know the Academy of Breastfeeding Medicine has just revised their patient-facing, family-facing materials for sleep trade-offs. And just the only thing I'll say is many people do intend, and so I think we're all here to authentically connect and to, serve them, through this work.
And I'll drop in the chat the link to North Carolina's Safe Sleep campaign, where there's